of PSN on the plateau, representing the Pharmaceutical Society of Nigeria. This webinar is in collaboration with ARC, University of Jos, FIP, and Empower, and the Federal Ministry of Health. So thank you. The objective
if I just take the housekeeping announcements first, please.
Housekeeping announcement, I think.
Okay.
Yes.
Okay, for all participants, can we please ask that you mute your microphone and turn off your video to reduce background noise and bandwidth? If you wish to ask questions during the presentation, please use the chat box and you can raise your hand using the little raised hand icon. We will be conducting some polls. Please do participate in the polls. It helps us to adjust the presentation to your exact needs. The webinar recordings will be available on the Empower of School website and YouTube channels. So you will get a chance to see everything that occurs today. The slide deck will be shared with all the participants. At the end, please don't leave without completing the final poll on the feedback. That helps us to make these presentations better for the future. Our agenda today is really, why would you consider a career in health procurement and supply chain? And we hope to be able to explain that to you. There has been a great shortage of supply chain and procurement staff for the global health supply chain. Why is there such human resource capacity deficiency? If you're interested in the field, how can you get started? How do you find the correct accredited courses which match your needs? After that presentation, we go into open discussion and question and answers. For those question and answers, please type your questions in the chat box. Okay. Okay, back to Prof. Jacob now for the objectives.
Andy, why don't you continue?
Okay, so really for the objectives for this webinar, sorry. Okay, Professor, go ahead.
Yes, I don't know. Okay, thank you. By the end of this webinar, we expect participants to have a good understanding of career choice in global career for pharmacists, and that will include access to medicines and procurement and supply chain. So let's go on. It's my privilege to introduce to you an eminent professor of public health. He's been involved in this for long. Professor Andy Baraclaw is a professor of public health. He's been involved, is a director of training of the Empower School of Health. Andy is the co-author of the popular Yellow Book that we all know. So you are meeting an erudite scholar today. He's been involved in this for many years, more than 40 years, more than 25 years, and he has been to many countries. So Professor Andy, you are welcome.
Thank you very much. And now it's my turn to introduce Professor Jacob Kolawole from the University of Jos. It's many years since I've been in Jos, but I've always found the university there excellent. He's also a consultant for the West African Health Organization, and particularly on developing guidelines and training materials for finished pharmaceutical products, as well as raw materials and the detailed operating procedures that are needed. So a very accomplished moderator that we have with us today. Okay.
Thank you, Andy.
If I can ask the Pharmaceutical Society of Nigeria now, please, to introduce themselves.
Dr. Dangiwa, can you please do that?
Yes, sir.
Okay, good. Please go ahead.
Dr. Dangiwa,
Can you please unmute? Can you please unmute? Yeah, there you go.
Yes. My name is Dr. Dauda Audit Angiwa, the chairman of the Pharmaceutical Society of Nigeria, Plateau State Branch. I'm a lecturer with the University of Jos. I had earlier worked in the industry, rising from the status of a medical representative to the status of a regional sales manager with a multinational company, Nigerian Hext, which later translated into Nigerian German Chemicals. I was involved in sales and training of managers, both sales and marketing of pharmaceutical products. Before I joined the company, before I joined the university, I'd worked at various levels, and I still do some consultancy to companies that call me for product presentations and drug distribution outlay. Thank you.
Professor Dauda, Dr. Dauda, can you, if you could actually introduce the Pharmaceutical Society of Nigeria. Yes, if you look at the slide, that is,
okay.
Can you see the slide?
Yes.
on the Zoom chat?
Yeah. The Pharmaceutical Society of Nigeria is going to be 93 years this year. It's a society that encompasses all the pharmacies in Nigeria. Each state has a chapter, and the federal capital too has a branch headed by a president, while the states have chairmen. The Pharmaceutical Society of Nigeria sets up guidelines, ethical guidelines for practice of pharmacy in different facets of pharmacy practice, be it from the academia, community, hospital, logistics, and all have you. The Pharmaceutical Society of Nigeria also has an ultra logistic company, which, because of the chaotic drug distribution nature in Nigeria, contributed her own quota towards sanitizing the system by setting the OCO logistics. In 2012, groundworks were done, and contributions were made by different members of the society at the different branches to set up a mega distribution outfit, which is also cascaded down to the regional levels and the states. Also, a technical arm of the Pharmaceutical Society of Nigeria, known as the Association of Community Pharmacists of Nigeria. They also have, because they deal directly with the community and handle most of the pharmaceutical products and devices, they also have, in various states, a drug distribution outlay where members can source for genuine pharmaceuticals to avoid the issues of counterfeiting, faking, and substandard products getting to the end users. So the Pharmaceutical Society of Nigeria has designed and supports the federal government in giving an outlay, an organogram, a channel of drug distribution system that gives the patient the right drug at the right quantity and the right quality. Thank you.
Director Arabiana, are you able to connect? Are you online? Well, everybody knows the Federal Ministry of Health and the director and director as well. There's a more detailed introduction of Director Arabiana later on. If someone can guide her to connect, she might be having connectivity issues. Okay, please let's move on. Back to you, Andy and Prof. Kolawale.
Okay, from the University of Jos then, please. If you'd like to present on the University of Jos.
be.
Okay, yeah. Professor Gaji. Okay.
University of Jos is a federal university that was established with the vision of being an innovative institution with great interactions between GAU and the town. The University of Jos is committed to providing education that is globally competitive and relevant to the needs of the people, the ever-changing needs of the society. The university was actually established in 1971 as a campus of the University of Ibadan, but later on it became a full-fledged university. And as the university grew, many faculties were added, and Faculty of Pharmaceutical Sciences happens to be one of them. The faculty started from Makurdi, another university, federal university. But today, at the University of Jos, we have the Faculty of Pharmaceutical Sciences that is positioned for both the undergraduate and postgraduate training of pharmacists and other healthcare providers. The current and who is the 9th substantive Vice Chancellor of the university is Professor Sedi Sebastian Memako, who assumed duty in June 2016. University of Jos, like I said, has many faculties, and pharmacy is one of them. And the present dean of that faculty is my very self, Professor Ikoni Ogaji. Thank you very much.
Okay, thank you very much for that introduction.
Just before you proceed, could I just ask the admin team? I think Director Aribiana has joined, but she is not able to unmute herself. Hitesh, could you just do that? She's joined from Nokia 5, I believe.
Hello, Paul. I'm available. I've been unable to unmute, but I've not been able to mute my mic. Thank you.
Okay. All right. So could you? All right, that's fine. So what we'll do is when we come to you, you could team, please note that the panelist has joined and make sure that she's able to unmute herself as well. Right, please go ahead. We have Azuka for ARC, and let's move through this quite quickly so that we can catch up to lost time. Thank you. Over. Can you make sure that Azuka can unmute herself, team?
Thank you very much. Good morning, good afternoon, everyone. I hope you can all hear me. Can you go back to the slide that talks about Africa Resource Center? Thank you very much. So it's a real pleasure to be here. To all my pharmacists in the house, as men of honor, it's an honor to be here. This is exciting. I always love connecting with pharmacists in Africa and talking about supply chain management. Many people have introduced themselves, and the emphasis on there is a skill set that we didn't get in the university, but that we have opportunity to get now if we want to play in this space of making medicines available in a way that it adds to human life. So Africa Resource Center is a supply chain organization, but not an implementation organization. Our job, or we were put in place to be that connector. If you look at it, connect, complement, collaborate. We are put in place to be that connector within the health space, connecting governments to private sector, connecting governments to academia, connecting academia to private sector, just connecting all the resources that are in the space to best practices in supply chain management. We are a complement because we recognize that in connecting all the key resources, we cannot then say we have actually changed or transformed the world. What we can say is that the efforts that we put in the space is able to bring in all the right resources in a very efficient manner, for particularly to strengthen public health supply chain, supply chains. Our role is to facilitate collaboration. So when we connect, whether it's government to private sector, we then facilitate collaboration. So in a sense, I always like to describe ARC as a library. If you can imagine a library that has resources, a library would just stay where it is, except you go to the library. So in a sense, ARC cannot bid for work. We don't go out to look for people to say, oh, give us money to strengthen last mile delivery or transportation or warehouse management. No, we are a library. And in being a library, we have different resources within us. Whether it's best practices within private sector, we have private sector members. We also collaborate with the likes of Empower because we collaborate with educational institutions of learning where people can then have access to training programs. I heard Professor talk about me pestering him. Yes, because when we wanted to build this library, we wanted to ask for schools in Nigeria that are delivering supply chain education. And University of Jos was one of those we went to and said, look, you must be able to have this facility within you. So in a nutshell, if you imagine us as a library, when you need resources, people that deliver training, organizations that deliver training, or as a government, you need to be connected to best practices, private sector training, ARC is the place to go. So it's how do I put it? It's an honor to be here as a pharmacist that have grown and been able to champion this process of ARC, and I'm looking forward to more. Thank you.
Okay. Very much. Okay, International Pharmacy Federation. We use the French acronym FIP, Fédération Internationale Pharmaceutique. FIP is the global body representing pharmacy and pharmaceutical sciences. Over 100 years old, more than 151 countries are members. And it really seeks to react at the global level and set global standards and global best practice. Works regularly with World Health Organizations. Many of you will already be familiar with the GOOD series, as in good manufacturing practice, and good pharmaceutical practice, GPP, which FIP helps to develop. And of course, all of you will know that this week is World Pharmacy Week. Unfortunately, this year it's a virtual event, but all this week, World Pharmacy Week, and tomorrow is Pharmacist Day. So please celebrate that tomorrow for everyone. Lots of information available online with FIP if you're looking for more, particularly good practice guidelines and global standards. Okay, it's time now for a poll. Poll will appear on your screen shortly. Please select just one answer from the question. So first question, what is your gender? What is your age? Pretty straightforward. Go ahead and complete the poll now, please. Just select one choice. I can see we have a lot of computer knowledgeable people. It's just coming up for 1 minute and we're already at the 50% mark. Thank you very much. If all of you will please complete the poll.
Hello, Paul. Are we not taking that of the federal government?
I'm sorry, I didn't quite hear that. Can we put it in the chat box and I'll try and respond to it?
Andy, I believe that is Director Aribiana, and the introduction for the Ministry of Health skipped over because she was not able to unmute her mic. So after we're done with the poll,
we'll go back.
Make sure we do that. Absolutely. Right. I think that's what I heard.
Right. Okay, just another few seconds for the poll. I think we're past 80% already. Okay, let's stop the polling and share the results, please. I see we have a reasonable gender balance between male and female. We're coming close to 50% on both. We're very pleased to see that. And the majority of people are in the 30 to 40 age group. So people like myself in the over 50s are in the minority, which is good. So really, we're getting the focus of people looking for career development. Geographical region, of course, most are from Nigeria, but I did see a number from Sri Lanka have also joined us today. So that's very interesting. Academic background, and of course, the majority are in pharmacy with pharmacy degrees. Okay. All right, so we can stop sharing the polling results now. And I will take us back to the Federal Ministry of Health. Okay. Okay, if you'd like to introduce the Ministry of Health now, please. Can you unmute now?
Hitesh, can you please make sure that Mrs. Director Aribiana can unmute herself?
Okay, thank you.
Okay, that looks good now.
Thank you, Paul. Good afternoon, everyone. Hello.
Yes, we can hear you well.
Good morning, good afternoon. The floor is yours.
This is Mrs. Aribiana on the line. Mrs. Aribiana is a staff of the Federal Ministry of Health. She is a director with the National Product Supply Chain Management Program of the Food and Drugs Department of the Federal Ministry of Health. The Federal Ministry of Health, like we know, the provision of quality stewardship and services to all Nigerians, is a world-class government institution that ensures a healthy Nigeria. It also develops and implements policies that strengthens the national health system for effective, efficient, accessible, and affordable delivery of health services in partnership with other stakeholders. Our core values are excellence, competence, integrity, diligence, innovation, accountability, equity, teamwork. And at the federal government, we are the engine, we drive the engine as far as the country is concerned. We are involved in policies that concerns healthcare delivery. We work with all stakeholders, both local and international, to ensure we give quality healthcare to Nigerians. And as the National Product Supply Chain Management Program, we are the supply chain engine of the government of Nigeria. We collaborate with all partner stakeholders, institutions, as far as Nigeria is concerned, in terms of supply chain activities. And we do that with utmost responsibility, accountability, and selflessness. We started as a program, as a division within the Federal Ministry of Health, and metamorphosed into a national program. And we've been on board since 2012. And we have collaborated with ARC in developing supply chain capacity, human capacity, as far as the pharmacists are concerned in Nigeria. Thank you, and over.
Hey, thank you very much for that. Okay, so Our next panelist is Professor Paul Lalvani. He is the founder and director of the Empower School of Health, which is, although founded in India, is present in many countries now. He is the deputy chair of the People That Deliver, which is the organization hosted by UNICEF, and founder of the Center for Digital Learning in Global Health. Online learning is what it specializes in. Former head of the procurement and supply chain at the Global Fund in Geneva, and has advised World Health Organization, World Bank, UNICEF, Gates Foundation, and several other major international organizations. Very pleased to be here today, and we move on now. Okay, over to you, Paul.
Andy, thank you very much. First of all, it's an absolute honor to be present during this webinar with incredible panelists. It's a humbling experience. I've met many of them in person and some only through their reputation, and I look forward to collaborating with them very closely. So thank you very much. Just before I jump in, I should also mention that I'm almost half Nigerian. I've spent almost 10, 12 years in Nigeria. My family has been there for more than 45 years. I was married in Nigeria. So like I said, I'm practically Nigerian myself. We also have more than 100 either graduates or students of the Empower School of Health in Nigeria as well. And so a quick introduction about Empower before we just jump in. As the slide indicates, we believe leadership and management is probably one of the critical skills that everybody needs, especially as you move into senior positions, but you have to start thinking early. And President Kufuor, His Excellency, is an incredible human being, and he has guided and met many of our students. Next. Our areas of focus, besides supply chain, which is our core area, and we're known for that, we are working in all areas of communicable and non-communicable diseases, maternal child health, antimicrobial resistance, and new product introduction. Next. What makes us unique and why many organizations, as you can see in the right circle, are working with us? It's donors, public sector, private sector, is that half our organization is global health supply chain, and the other half is a mix of technology, capacity building experts, bringing together e-learning, and especially in the current environment where e-learning is vital and critical, where we're talking about new ways of learning, and we've been doing this for the last 5 years. And it's absolutely fundamental when you know that on ground, real time, on demand, and on the job learning is where we should be focusing. Next. Just to say that we've reached out, it says 100,000 learners. We've crossed 200,000 people trained across multiple countries. Next. And if you can imagine yourself learning while you're sitting at your office or at home, we've been doing that for many years, but now we've been asked to support learning and training at the last mile and bringing in technology. And often technology is not available in villages and the last mile. And so we've provided a solution where we bring digital learning tablets, provide ongoing continuous support to communities and learners, and then put everything back in a bag and move on to the next community and the next community. And these are the kinds of innovations that we are bringing to learning across resource limited settings, across India and across Africa. Next. Next. Yeah, that's fine. It's lots of partnerships across Africa, across Asia as well. With that, I pass the floor back to Prof. Andy, please. Over to you. Thank you very much.
Okay, so why consider health procurement and supply chain as a career? Well, Perhaps the biggest, nearly 2 billion people, nearly a third of the world, do not have access to essential medicines. What's the point of us studying pharmacy, of us doing academic pharmacy and manufacturing and research and development to all these wonderful medicines if we can't get them to the patient? And unfortunately, too often we can't get them to the patient. If you look at the world map, you can see the red areas are mainly in Africa. We're failing to deliver the medicines where they're needed. That's really the challenge of procurement and supply chain for us, and why we need to turn that situation around. Many of you will be familiar with the Sustainable Development Goals, these major targets that we want to achieve. If we look at goal number 3 for health, we find that every target requires us to have a reliable, uninterrupted supply of quality assured health products, and especially medicines. 3.1, reduce the global rate of mumps, measles, and rubella. To do that, we need measles vaccine. We don't have measles vaccine, we can't attempt to address that situation. 3.2, deaths under 5 years of age, often from diarrhea. We need very simple, very cheap product, oral rehydration salts, ORS, but we're not getting it to the patients. 3.3, end the epidemics of AIDS, TB, malaria. We need antiretrovirals, artesunate combination therapy, antimalarials, and the newer drugs for TB like bedaquiline. All of these products we've got to get through to the patients. If we don't achieve that, then all the research and development is lost. And we know we're failing. We have this classic quotation from the Director General of World Health Assembly: all the donated drugs in the world won't do any good without an infrastructure for their delivery. If we can't get them to the patient, they're not got any therapeutic value. So we talk a lot about last mile delivery and last mile logistics. How can we get them through to the patients? In this chain of life, the supply chain for health products is a chain of life. It brings better quality of life, and it brings continuation of life for many. Okay, time for poll number 2, please. Tell us a little bit about yourself. We'll put the poll on the screen now. If you're a pharmacist, which area of pharmacy are you working in? Please select just one answer. Even if you're working in 2 or 3, select the one that you feel is most appropriate for you. And again, which type of organization are you with? And have you previously worked in the supply chain? If you'd like to go ahead and start voting now, please. I can see you're all experienced pollsters now. We're not even at 1 minute and coming up for 50% have already voted. Maybe slowing down a little now. Please, if you're not already voted, please go ahead and do so. Okay, I think we can stop the poll now. We're not progressing on that, and share the results, please. Okay, so we have a pretty even split between retail pharmacy and hospital clinical pharmacy, with quite a lot having worked in the supply chain as well. That's very encouraging to see so many of you involved in the supply chain. For retail pharmacy, our talk today also has relevance, and I will bring some points home for retail pharmacy. Which type of organization are you working for? Pretty evenly split between the private sector and the public sector, 30 to 38, and some academia as well. So a very good split there, but a lot from government bodies, good. Have you previously worked in the health supply chain? Majority, 60% have, but nearly 40% have not. So this talk will be of, we hope, particular relevance to you. Okay, we can stop sharing the results now and we can move on. One of the major challenges we have in global health supply chain is the lack of human resource capacity. We don't have enough people, and the people we have don't have the skill sets in procurement and supply chain management. Major survey by World Health Organization, Overcoming the Crisis, said that workers require national government support in training, supplies, and financing to address this situation. If we want to get medicines to patients, we have to have an efficient supply chain. To do that, we need the human resource capacity to operate and manage that supply chain. Well, why is there limited human resource capacity? Well, regrettably, very few schools of pharmacy teach very much procurement and supply chain management. Increasingly, they teach some, but usually it's not adequate for the scale of the problem. Almost no management schools teach pharmacy, which is perhaps not surprising. The health supply chain needs pharmacists because many of the medicines are technically complex. But it needs pharmacists who are knowledgeable and skilled in procurement and supply chain management. And that means that pharmacists have to go beyond pharmacy to acquire this knowledge and skill sets. The field is becoming even more challenging because of major investments by the global organization in research and development. There is a massive expansion underway of new products. Diseases which have not seen a new product for 40 years, like tuberculosis. We have been using the same medicines for 40 years to treat tuberculosis. Now there are new tuberculosis medicines coming through the pipeline, but they're complex, they're difficult to manage. There are literally hundreds of them, over 436 new products about to come, which will address many of the communicable diseases that we have been working with for so many years. They'll make a real change, but only if we have a supply chain which can deliver them through to the patient. There are many organizations involved in the global health supply chain. When people think of the United Nations, they tend to think of just one or two organizations like UNICEF. But there are many United Nations organizations involved in the supply chain, and there are many organizations. Of course, there are federal and state government to consider, as well as the international players. Who are these key stakeholders? The government, of course, donor organizations, and there are lots of donor organizations. People tend to focus just on the big names like Global Fund and USAID. Yes, they are important, but there's lots of smaller ones that also support supply chain operations. Government of Luxembourg, Holland, Switzerland, all contribute to this process. So as you're looking around at donor organizations, don't just focus on the large one. Lots of UN agencies, implementing agencies, organizations like Chemonics, Management Sciences for Health, John Snow International. There are lots of non-government organizations, and especially in Nigeria, the faith-based organizations like CHAN. Also the not-for-profit sector. There are advocacy organizations, Of course, all the university and academic institutions. Increasingly now, we're seeing health insurance groups, because the insurance industry recognizes the need for effective and efficient supply chain and is increasingly becoming involved to help manage their costs and healthcare delivery. The private sector, especially around corporate social responsibility. Large organizations paying to fund activities, again, especially around supply chain. And of course, there are small local community groups focused on patients and beneficiaries, which also contribute. Okay, Prof. Paul, do you want to take over from here?
Sure, yes. Thank you. Prof. Andy, that's a really good introduction. And what was good to see is that we had a large number of participants who are in their 30s and 40s with 5 to 10 years experience, which means it's a perfect time, and especially now, during nowadays, as the market continues to evolve. You mentioned almost 400 new products being introduced, the technologies for learning, the technologies for health products, the technologies in the way health is treated, they're all evolving. And as pharmacists and as health professionals, we need to evolve and grow as well. And the 30 and 40-year-olds, you need to keep learning, bringing new skill sets in order to be able to work in different areas. And again, in a decade's time or 5 to 10 years' time, there'll be new skills you would need again. And here, for example, is a list of large number of UN jobs that are pharmacy linked. This would go on pages and pages, depending on where and how you'd like to be able to join and where you'd like to contribute. And that's just the UN. And as Prof. Andy mentioned, there are many other opportunities. And again, areas I wish I was aware of when I was your age. Next. So how do we get started in this field? If you are interested in supply chain, pharmacy school doesn't prepare you and management school doesn't prepare you. Yes, there are SIPs and CIPS and CILT, and we actually partner with them in terms of bringing together the field of logistics, supply chain, and pharmacy and public health, because each one is still verticalized. And what we need to do is to be able to bring together these the health sector, the pharmaceutical sector, and the supply chain sector all in one. Next. So the first option you'll see is free of cost, very valuable introduction. And these modules we prepared on behalf of UNDP. They're available on our website. We encourage you to take these. They're available in any language, although if you're Nigerian, most likely you'll be doing it in English. And you'll be done within a month, and you will get a UNDP certificate. It'll give you a fantastic introduction, especially for the 40% that are not working in supply chain. This would be a great intro. Next. If you want to think more deeply in terms of where the job opportunities are, both in Nigeria and globally with international organizations, and how these international organizations come together, think about a short course in terms of exploring an international career in global health and supply chain. How do all these organizations work together? What's relevant? Where are the jobs available? How do I position and prepare myself? How do I create my own roadmap to join this sector? Next. And our flagship course is the postgraduate diploma in global health procurement and supply chain management. It's been developed by former UN staff, former Global Fund staff, and we have almost 1,000 either graduates or current students who are enrolled in this course and are working for various organizations from ministries of health, UN, and civil society organizations. Next. All these, you can find many of these courses that are available on our website and with our various partners as well. And we are doing these in partnership with either other universities, the pharmacy councils, and we've teamed up with almost half a dozen pharmacy councils across Africa and Asia and the most recent partnership with FIP as well. We'll be releasing many more courses, certificate, diploma, postgraduate diploma, and we will be launching our masters later this year as well. Next. And all of these are available online. We realized, in fact, the request, we used to do everything face-to-face and classroom-based. It was very expensive and many people could not afford it. And it's really difficult to put your life on hold, put your family on hold, drop your job and go learn 1 year to 2 years, do your master's, whether it's an MPH or any other degree, or even a 6-month course would be difficult. So 5 years, actually 10 years ago, we started capacity building, and about 6-7 years ago, we started online courses and training. And although the whole community is now, because of COVID, is focused on this area, we've been working in this area across various diseases for more than 7 years now. Next. So with that, we have a panel discussion, and what we'll do is one by one introduce the panelists and ask a couple of questions to them as well. So could I ask the moderators to, Andy, if you'd want to start, ask a question for Mrs. Aribiana. Introduce her first. I think that's the next slide. And can I ask Hitesh and team to make sure that Mrs. Aribiana is unmuted when she starts to speak. So Andy, your question for her, and over to you both. Thank you.
Okay, just give me a second to put the slide back up here, and then we'll.
Yeah.
Okay, there we go.
Head up. You want me to put the slide up while you get the question ready? Is that?
If you would, please, yes, that would be a better option, yes, okay.
All right, let me share my screen then. Continue.
So I would like to unmute you. I have unmuted.
Yeah. Can you?
So what the connection?
This now has been connected to this.
So why are we not getting the sound?
Okay.
Right.
Okay, I've seen the question. Okay.
Andy?
Yep, okay, so are we...
Right.
Can I go ahead and ask the question?
Yes, please.
Yes, for the Ministry of Federal Ministry of Health, Mrs. Olubumi. All right. I believe Olubumi is hearing me. More than 40% of Ministry of Health budget is usually spent on procurement and supply chain of health commodities. Pharmacists play a key role part in this, as you know. We also do. We also know that most pharmacists and logisticians have not been trained in supply chain management in universities. The question now, how have you, as a leader in the Department of Pharmaceutical Services at the Ministry of Health, developed your own professional knowledge in global health procurement and supply chain? And number two, many Ministry of Health pharmaceutical supply chain management staff are graduates of Empower School of Health. They have their PGD online. How can Empower make this course more available to your staff in the Federal Ministry of Health?
Thank you very much for your question. Empower can make it available to my staff in the Ministry of Health, one, by making the course online, or two, by having an in-house training, or three, we can also have a short course, depending on how you want it to go. However, the Ministry of Health staff are willing to diversify in their knowledge and work practice So it's a welcome development, but that is the only way we can have it. We can have it as a postgraduate degree in any of the universities, and those who are willing to go back to school can go back to school and learn, while those who do not have the opportunity can do an in-house training or online training. Thank you, and over.
Thank you. How did you develop your own self? Just give us a brief.
Okay, developing myself just came by the wings because I've been in the system for over 27 years, like I said, and we've been carrying out supply chain activity without calling it supply chain because I've been a pharmacist. We have so many hidden components of supply chain within our practice as at that time, and nobody ever called it supply chain. But then when I moved to the warehousing practice of my profession, we had GSI that came on board, and they took us through short courses in logistics management and information system. That was my first encounter of having a formal education in supply chain. And thereafter, we continued with our short courses in so many other aspects of supply chain. And here we are today as the head of the supply chain management program for Nigeria.
Thank you very much. For our audience, it is good that we know we can develop ourselves online while we're in the home or in our houses, in the offices, and as well you can go to school, just as she has explained, at the federal level. If they can do it, I want to believe you can do it. The University of Jos is partnering with both Empower and ACT. We're developing programs from the certificate level, diploma level to PhD level. I'm sure the Dean will talk about it when it's time comes. Mrs. Olubumi, thank you very much.
Thank you.
Back to you, Andy.
Okay, yeah. Many thanks then. Okay, let me check that I am okay.
Andy,
yep.
Is there any question for her from the audience?
Not yet, no. But I'll perhaps ask Azuka from ARC. You've had a unique career path. Could you share a little bit of your journey and your role at the African Resource Center with us?
Thank you very much, everyone. And it's delight to see my boss from Olubumi. I hail you, Ma. Thank you so much. And also Professor Kolawole. Share delight to be as a member of this plenary session. So for me, is one of the things that inspired me in my role. I recall, having a meeting with Bill and Melinda Gates Foundation, the Global Funds. You could call it the big, like we mentioned, the big donor agencies. And I was in that meeting and they said to me, well, in Nigeria and also in many African countries, we have people that practice supply chain, but they don't have the professional background in supply chain management. And that is why the public health system is really not as efficient as it ought to be. And they said, how can we get the non-pharmacists to take over the supply chain work or operations in Nigeria? And I said to them, well, I'm a pharmacist. I can't take this away from my profession. And the question was, but why? It's not necessarily a pharmacy program. So what is the business case for pharmacists or pharmacy schools, or to get further degrees in supply chain management, and how would that really improve things? So the case is, in reality, is that in health, or rather I would say in different continents, there are different focuses when it comes to supply chain management. If you look at Malaysia, for instance, or even in the South America, where agriculture is a strong point, one could say, yes, maybe School of Agriculture, domicile supply chain management in your program.
Zuka,
if you go
I think we've lost the sound on you.
Okay, can you hear me now?
I can. Yeah, I can hear. Azuka, yeah, please continue. I can hear. Go ahead.
Okay, thank you. If you go to the United States of America, Europe, you will see that a lot of supply chain, you talk about businesses, technology, the same in China. So one could say perhaps in that, advanced supply chain, you don't necessarily need pharmacists. You could go to the engineering field or management field to take on the supply chain role. But when you talk about Africa, a major, I would say a major market in Africa is health. A major market, you need to look as you grow in your career, you need to follow the demands in the market. One key area that is really evolving is the health market, whether it's in health financing, whether it's in production or manufacturing, whatever the cause, health is a growing business in Africa because of the need. You've done your supply and demand. There is a huge need for health. So for me, it was a case that in Africa, in Nigeria, for instance, health and making commodities available for health rightly fits into the pharmacy profession. So for me, in my career, and even in talking to the donor agencies, I said, well, you cannot compare the maturity of supply chain in other regions, and also compare that to Africa. Our demands are different. And if we want to improve the availability of health commodities in Africa, then the key people that manufacture the medicines actually should take on strongly supply chain management, so that it is an end-to-end process. We do industrial pharmacy, where we look at, and we do, the pharmacognosy, where we look at raw materials. Then we move into the industry or the dispensing. Then there is a gap. Next thing, we start selling. Who bridges that gap? Who advises from the manufacturing down to getting the commodities available? So there is a huge role that pharmacists should play in making medicines available in Africa, in Asia. So my job in ACAM, which is one of the reasons why I took on this role and why I've grown in it, is to make sure that medicines are available for all the people that need it in Africa. We cannot put it in the hands of engineers. Engineers or business people, they will always think profit. But we that have the heart, we swore the oath of making sure people have medicines that will save lives. We will know the pain of when you get to your village. Many of us have villages here now. When you get to your village and you have malaria and then you can't get it from the nearest primary healthcare center, that is a pain. Then we should take it on. We can't look at what worked in America. This is Africa. So, to end is how my own journey. I started off, I got the pharmacy degree. Then I went into, at the health facility level. I'm one of those rare people that worked from the healthcare facility level. Of course, before then, I had done my rounds, like Paul said. I had entered hospital pharmacists. I did that. I went into community pharmacy practice. I left that. I went into sales. I also was a sales rep. So I did all that. And then I decided, okay, I want to do more humanitarian work. I left. I was a very successful sales rep in Enugu State. I left that, and then I entered the humanitarian work with in a USAID project, but at the health facility level. But from there, loving the role that pharmacists can play in making HIV/AIDS commodities available to clients, the power that we have in, advising patients. It really inspired me, and from there I grew into the NGO sector. So for the pharmacists, there's a multiple role you can play in this space. I went into the NGO sector, the Catholic Relief Services, as a supply chain specialist, and where I covered almost 20 states in Nigeria. So you can know how mad that is. You young pharmacists. When we were entering Plateau State when they were bombing in Plateau, we were entering, going to Kano and worked in Kano, worked in Adamawa. As a supply chain pharmacist, basically the need is so much that it takes you all around. I worked in 20 states, that's crazy. But then after that, that made me understand the need even more. And the skill set, that was when I realized that you cannot be a pharmacist in the supply chain industry and not know how to use the digital platforms. I went to, Paul was talking about the digital platform and how online. I always feel so sad when I see pharmacists that can't use Excel. Young pharmacists, make sure you know how to use online platform. Make sure you know how to digitize. So it was at that point I realized the need of disability. Finally, from that, I went to do my degree in public health. So I didn't go to do a degree at that point in more supply chain, but in public health. But then I returned back to Nigeria. I did that in University of Liverpool. I used the scholarship. So there are several scholarships options. So I would encourage us to look at that. I came back and I diversified quality. It was there that when I was focusing on public-private collaborations, I worked with the World Economic Forum. Again, just to put it out there, the power of being a pharmacist in Africa is amazing because you can practically play in all fields. One thing you need is a spirit of excellence, the spirit to continually learn, the spirit to understand the market, the need in the society, and get as much training that you can get, whether free or you pay for it, invest in yourself. That was what made me grow. By the time I came back, I focused on public-private collaboration. I worked with the World Economic Forum on that. Then I was now, and from there, you know what happened? I stopped looking for work. Work started looking for me. I was approached to come and lead the ARC in Nigeria and turn it into a transformation work in Nigeria to facilitate public-private collaborations. And that's why you see me work with Aribiana, Professor Kolawole. It's really what we do. And that has put me in the global space. I now advise donor agencies. I advise Bill and Melinda Gates Foundation, the Global Fund, in how to invest in public health supply chains. I advise national governments. That's a key role we play, and we're happy to be doing that. I advise universities to take on supply chains so that we can have access. So beyond outside the country, in Nigeria, we have at least 3 schools or 4 schools that provide degrees in supply chain management. Not to take up all the space, but I would encourage you, this is a beautiful space to be in, but again, it requires you to think of the market. The need is there, but do you fit into the market? Do you have the right skill set? Look at all the things that have been shared and leveraged. Thank you so much.
Okay, thank you very much for that. That's a very inspiring talk. Okay. Okay, for the Pharmaceutical Society of Nigeria now, please. What are the ways that PSN is helping to support career development of pharmacists in Nigeria? And how can Empower work with you to try and expand the supply chain activities of pharmaceutical career development?
Professor Dangiwa, please, not this slide, and I think the next slide. Yes, Professor Dangiwa, can you speak to that?
Okay, can we make sure we can get you unmuted so that
While we're just waiting for...
Yes, he is...
good. Okay.
Yeah,
you're back. Please continue.
The Pharmaceutical Society of Nigeria is being headed by Pharmacist Mazi Sam Ohabunwa. The branches, the Pharmaceutical Society of Nigeria has many technical groups and some interest groups. At the national level, there's the ULCO, the Ultra Logistics Company. The Ultra Logistics Company gets products from multinationals and then cascades it down to the state, to the regions and the states. This same also, the Pharmaceutical Society of Nigeria gives her position paper supporting a standardized guideline to prevent the chaotic drug distribution in Nigeria. Different position papers have been given to the government of the Federal Republic of Nigeria regards disembarking or dismembering drug markets in various regions of Nigeria. The society frowns at that, and government bought into the idea right from about 2012 till today. By 2015, government has started discussing setting up a mega drug distribution company. In Nigeria, the last DG for NAFDAC, that is the National Agency for Food, Drug Administration and Control, she fought drug markets and had wanted a mega drug distribution outfit where a standardized format for drug distribution is followed right from the manufacturer down to the patient. Because we noticed that because of the drug markets, faking, substandardization, and adulteration occurs, because the Nigerian borders are porous, and then many parallel imports of branded and generic products flooded the market. The Nigerian market is very large. The Nigerian pharmaceutical market is very big. More than 30%, more than 70% of pharmaceutical products in Nigeria are outsourced from the developing economies, mostly from India, China. And these products, as they come into Nigeria, the pharmaceutical, many other countries bring in some parallel imported products from Pakistan and other nations of the world. And some of the products that come into Nigeria are fake. So because of that, the PSN stood her ground to discredit such charlatans and such spurious sources of pharmaceutical products. The PSN insisted and has always represented itself by presenting a position paper. Apart from presenting a position paper to the government for a mega drug distribution company, the government has bought into the idea, and most states in Nigeria have central medical stores, and they acquire their products and distribute them. But you know, the private sector, the pharmaceutical chain supply in Nigeria is mostly private driven. And so government also has regulatory bodies like, in partner with the PSN, there's what we call the PIC, the Pharmaceutical Inspectorate Committee. And this committee insists and monitors different pharmacy outlets and the types of drugs they manage. PSN also, in collaboration with a regulatory body like NAFDAC, makes sure that spurious products are removed and this chain is respected. In cases where products are not really available, they are labeled, they are not in the formulary, the Nigerian drug formulary, the essential drug medicines guideline, you are allowed to bring it maybe as an orphan drug for a specific facility. The PSN recognizes that and is always in any committee by the government to make sure that those specifications are adhered to strictly. So we concentrate presently on our onco logistics, and the community pharmacists, Association of Community Pharmacists of Nigeria, also have a drug distribution channel. The states acquire these products from transnationals and directly give them to their members who are community pharmacists. We also discourage other non-pharmacies, that is maybe patent and proprietary medicine dealers, from handling prescription products or ethical products, so that if you are caught with them, the chances or the quality and the quantity of the active ingredients is questionable, because we do not know your source. And we insist, because of the storage conditions, so we insist that only pharmacies handle that by the PSN, because you are knowledgeable right from products, from galenical sourcing to the final product being given to the patient. So the PSN insists that every hospital should have a pharmacist. Every hospital should have a pharmacist who will insist on this drug chain delivery to the patient.
Okay, I'm sorry to interrupt you there, Dr. Duada, but we are very aware of time. So you're giving an inspired speech, which is really motivating people. But I'm sorry, we have to push on a little bit because we are getting close on the edge of time allowance for us now. If I can move to the Jos University, please. And just to ask, Jos School of Pharmacy is one of the leading colleges of pharmacy. How can you expand the curriculum to give graduates more options and especially support them around procurement and supply chain? Just a few minutes, please, because then we have to close the session.
Thank you very much. Jos University, as has been mentioned earlier on, is a federal university, and we are open to changes. We respond positively to the needs of the society, and we have come to understand that supply chain is a must for pharmacists so that they will be able to handle pharmaceutical products responsibly and efficiently. And so we, at the moment, partnering with Empower, and also ARC has helped us a great deal to establish the supply chain present. We run programs now in supply chain. Although there is a component of supply chain in the undergraduate curriculum, but it is not enough to to equip the students. So we run we are partnering with this establishment in all of this to be able to position the graduate pharmacist properly in supply chain, in supply chain of pharmaceuticals. I think that is what I wanted to say at this point, because it is very, yeah.
That really puts the scene very well. And we'll go now over to Professor Paul Lalvani, please, just to summarize some of the comments.
Right. Thank you very much. Can you hear me okay?
Yeah, all fine.
Yes, we can hear you.
Thank you. First of all, I really appreciated all the comments from all the speakers. Absolutely excellent, right to the point. And I'd like to highlight a few and emphasize a few of the things that were mentioned. First of all, before I forget, Prof. Ikoni, I mean, to be a Fulbright scholar is an incredible honor. So I'm very glad to be on the same panel as you, knowing that that's the kind of background that you have, and it's a great honor for Nigeria as well. So picking up on some of the points, number one that was mentioned, the power of pharmacists. Now, most of you who are attending are from Nigeria, and you may not have traveled. I've worked as a pharmacist, born in India, grew up in UK and Nigeria, and then worked in the United States, UK, and Geneva. The power, the strength, the respect that a pharmacist gets in Africa, and especially in Nigeria, where I spent a great deal of time, is tremendous. It's immense. And it's far more than other, for the same profession in other countries. That's number one. And you should be honored that you've chosen that profession. And now how do you strengthen it and grow bigger and better within that? You're also unique in that you bring the experience of public health, antimicrobial resistance, pharmacokinetics, pharmaceutics, everything that you're taught from a science perspective. How do you bring it to the public health perspective? And to really get that experience, you can either do what Azuka mentioned, she's gone and studied an MPH, or you can take specific courses, short courses on understanding the blend between global health and pharmacy. In fact, we just finished a conversation with the CEO of the International Federation of Pharmacists, FIP, Catherine Dugan is her name. And jointly with FIP, next month, we are going to be launching a series of webinars on pharmacists and transforming global health. And we'll be working across multiple regions, starting with Africa, going to Asia, Latin America, former Eastern European and European countries, etc. And the focus really is expanding the role of the pharmacist beyond just retail, hospital, and manufacturing to literally transforming global health. So please prepare yourselves, strengthen yourselves in the work that you're doing. Supply chain is a natural fit. And another thing I should highlight when you all answered your question, less than 1% of the pharmacists said that you're not working currently. Now, in America right now, there's a 15% unemployment rate, 12 to 15%. Pharmacists across the world usually are very well employed and well engaged. How can we help you and strengthen teaming up with the Pharmaceutical Society, with the universities, with academia, with organizations, civil society organizations? And Azuka's experience, what she mentioned, she is one of many such people within Nigeria. And as Maribiana mentioned, and given her experience, we're on the same board as people that deliver. She also has a global footprint, as she does a national footprint as well, and heading the supply chain organization department within the ministry as well. So tremendous experience. So with that, I'd like to thank everyone for your comments. And Andy, do we leave the
Yeah, one more
floor?
poll, please. Before you leave, if you can complete the final poll, we'll put it on the screen now, please.
Right. Sorry, I meant, don't we ask them for questions on the chat so that the participants
Yeah, we've
can...
had some questions coming in. If you want to take a few more minutes just while we're doing the poll, I'll try and answer some of those questions.
Okay, very good, very good. So if we could ask the participants to answer this poll, and then please start typing your questions in chat so that the panelists can reply to your questions as well. So first the poll and then the questions, please.
Okay, we have more than 50% voted, so just another few seconds and then...
Yep, good idea. Let's take it to 75%, 70+%. So we have a good take then. So what's good to see is a lot of people heard about this through the Pharmaceutical Society, through Empower. We do have a monthly mailing. We have a lot of social media that's active, and through a lot of other sources as well. I guess friends, word of mouth. Yeah, email, social media being the highest. Almost 70% are members of the Pharmaceutical Society, which is great. And many of you, almost combined, about 25% have taken some of our courses. All right. Very good. Yes. Okay. So many people most people interested in supply chain. The most effective marketing campaign was from Pharmaceutical Society and Empower. So well done. And partly because we should have started the promotion much earlier. By the way, before I forget, we'll be launching a free course along with the Global Fund in investments, financial investments in supply chain. This will be launched in October jointly with the Global Fund. So as much as possible, we will help work with the society, with the council, with the universities to provide access to free courses. You can build a career also with that. You don't need to invest funds, but where necessary and you need to go to the next level, that may be required. All right, so look out for that in the next 2 weeks. We'll be launching that as well. Where did you hear about us? I think we've got all of that. Excellent. So we can stop sharing. 95% found it very useful. Very good. So could I ask the moderators to see which questions should be answered, can be answered, and which moderators, which panelists can respond to them? Over to you guys.
Okay, we've had lots of questions around the course fees. We can say the online courses are very much cheaper than classic education courses. Please contact Empower for details around that. There are sometimes scholarships available for Nigeria. People ask, are these certificate courses? Yes, they are, and transcripts are available. Sorry, go ahead.
Yeah, and I was just saying, just that people understand the range. Some of them are as low as, like I said, from free up to $2,500 is the range for all the different types of courses that we offer. When we launch the masters, it'll be around $5,000 to $6,000. So this is the range we are looking at. And in many cases, we have worked with the Ministry of Health, with donors to get scholarships for staff, and where individuals who are not employed by government or can't find funding, we have organized scholarships and payment terms that make it easy to pay over 6 to 9 months in small amounts as well. So first look for free courses, then we look for funding and scholarships, and then paid courses. Okay, over.
And I think it would be good. I
Yes,
think it would be
Prof.
good if you can check the website of Empower. There will be more details there. The courses range from certificate courses to diploma to postgraduate diploma courses. And someone is asking, when are we running the webinar again? I will get you posted before the end of October.
Yes, and this session has been recorded and will be shared. So in case your friends and colleagues have missed it, you should be able to view the whole webinar. And also we will send you the contacts. In fact, could we ask all the panelists and the moderators, if you are okay with it, you can type your email ID on the chat so that people can contact you, if that's okay for you. I'll type mine, and for those who would like to can do the same. Please go ahead.
Okay, we have one query here. Is an MPH, Masters in Public Health, sufficient for a career in supply chain management? It will certainly help. There are some elements of supply chain covered in most MPH curriculum, but by itself, the simple answer would be no, you need to go beyond what you will learn in the MPH for supply chain management. How do we access the scholarship opportunities? Look online, look at the Empower website, and you'll see those opportunities available for you. Quite a lot of people have asked for a list of schools doing supply chain. Prof. Kolawole, perhaps you could advise on that. I think Jos is already doing supply chain training, yes?
Jos is already doing, and along with Empower, we have the lower level, the certificate, the diploma, and the rest is coming on board. The master's degree is already on board, and that's in collaboration with ARC. So you are likely to have scholarship if you work with ARC, and with Azuka in there, you are already having internship position, you're already likely to have a job opportunity. It's always there. So you are welcome. And you can get in touch with the University of Jos Pharmacy School or the Dean. Another university that is on it is the one in Oka. They're also doing it. Nnamdi Azikiwe University. As of today, those were the major one, the University of Jos and Nnamdi Azikiwe. Thank you.
Okay.
Over to you, Andy.
I think yeah, thank you. I think we're well over time. So I'll just looking through the last few questions if we have anything there. Okay. Then I think it's time for closing comments.
Wonderful. Could I ask Pharm Aribiana from the Ministry of Health, are you still? Yes, you are. Okay. Can you please, team, can you please unmute? Yeah, perfect. Could I, as the highest delegate here from the Ministry of Health, if I could please ask you to make the closing remarks for us.
Okay, thank you very much, Paul. On behalf of the government of Nigeria, I want to thank everyone, especially the participants who thought it fit to hook on. I want to appreciate you people and say that there's always need for each and every one of us to improve on our academic career. We need to diversify, and we need to take every opportunity we have to improve on what we do. And that as a pharmacist, having a first degree in pharmacy is not enough for anyone to work with. We have to keep improving on ourselves, and there are opportunities up there for each and every one of us. We may choose to go back to school and do a regular master's degree program. However, if we are not opportune to do that, we should also look at doing some of these courses online, or get to attend conferences and meetings where we have to learn more about emerging development in the field of pharmacy. So on that note, I also want to thank the Empower Group that brought about this webinar and that also nominated us to be a panelist. We want to appreciate you all for that good work. The University of Jos, the starting block for supply chain training in Nigeria as a master's degree program. We also want to appreciate you for your good work. And on that note, I will say thank you so much, and over.
Thank you. Thank you. That's very nicely captured.
Arvina, thank you.
Yeah, please, the two moderators, if you could bring closure. Thank you very much.
Okay, I will leave that to Pref Kolawole, please.
Okay, thank you very much. Ladies and gentlemen, thank you. This is a good one. Professor Laveni, we thank you. Andy, we thank you. And all participants, we want to say thank you. See you again very soon. Over and close.
All the best. Thank you.
Okay, good night to all.
Azuka, thank you, so that you not take me out.
Thank you, all the panelists and moderators.
Bye.
Bye.
And I forgot, I'm so sorry, I forgot to thank my team, my admin team, and all the coordinators and organizers, Rahul, Hitesh, Sonia, and Preksha. Thank you for all your support. Take care. All right. Bye-bye.
Bye.